Good morning, everybody. Welcome back to our four-part webinar series, Communicating Climate Change as a Public Health Issue. My name is Kathleen Carley, and I'm a division manager in the San Luis Obispo County Public Health Department along California's Central Coast. We've got many comments from people about how valuable the first session was. For those of you unable to attend last week, you can access last week's webinar recording at www.healslo.com, HEALSLO.com. We are also going to post last week's PowerPoint along with some additional resources on our site, including Susan Joy Hassel's response to the question, should we be saying global warming or climate change? Our registration actually increased by about 100 people since our webinar last week. In addition to people you would expect to be on our call today from CDC, EPA, UC Berkeley, etc., we also have attendees joining us from all over. The Government of Alberta, Canada, the Macomb County, Michigan Health Department, the Arkansas Department of Health, and the Flathead City and County Health Department in Kalispell, Montana. As I mentioned last week, this series received funding from the Centers for Disease Control and Prevention and the California Department of Public Health Office of Health Equity. Its contents are solely the responsibility of the presenters and do not necessarily represent the official views of the CDC or the Office of Health Equity. Our topic today is climate change planning tools. We have 4 outstanding speakers who will provide case studies and practical advice on how to develop resources to implement climate adaptation measures. We will keep all attendees on mute, but we will monitor both the chat and the QA functions. Each speaker will make about a 15-minute presentation. We will allow time for limited questions after each speaker, and then we will open up the session at the end after each of the 4 has spoken, and we will take questions as we have time. Our first speaker is Michael McCormick, who is a member of the American Institute of Certified Planners, and his topic is California's integrated approach to addressing climate change. Michael was appointed by Governor Brown in June 2011 as a senior planner in the Governor's Office of Planning and Research, OPR. Michael is leading a number of efforts to implement the governor's goals around land use, climate change, and organizational change. His recent work, while on rotation at NOAA, the White House Council on Environmental Quality, and ongoing work with OPR, is focused on the nexus of high-level climate and sustainability goals and local implementation. Michael is passionate about successful institutional transformation by leading the development of partnerships, tools, resources, guidance, and programs that support strong action on reducing greenhouse gas emissions and increasing community resilience to the impacts of a changing climate. And with that, I will turn it over to Michael.
Great, thank you so much. And I really appreciate the invitation to be part of the discussion today. As mentioned, with the Governor's Office of Planning and Research. And we have a number of roles in the state. We are one of the leads on the state land use policy. Statutorily, we're in charge of the CEQA guidelines, the California Environmental Quality Act, for those of you that aren't from California. So it's exciting to hear folks that are on the line from other parts of the US and Canada. We have general plan guidelines here. So OPR is the lead on general plan guidelines and how those are developed, similar to comprehensive plans in other parts of the US. We're the military liaison for the state, working with DoD facilities and our contractors that work here in California. We provide a number of technical advisories on issues of concern. So, for example, the photovoltaics, distributed generation siting guidebooks, electric vehicle siting guidebooks, and military land use compatibility technical advisories, how to implement new legislation that comes out that affects local governments, that type of thing. We are one of the leads on interagency coordination, particularly under this administration, under climate change. We work within our state partnerships here and also national partnerships and internationally. We also have a number of executive initiatives that we're working on. And within OPR, we have a couple of fantastic organizations that many of you probably worked with, the Strategic Growth Council being one of the primary funders that benefit local initiatives coming out of the Greenhouse Gas Reduction Fund, and a new program called the Integrated Climate Adaptation and Resiliency Program, which I'll talk about a little bit in a few minutes. So we all know, most of us on this call here are probably very aware that climate change is happening now. We're seeing impacts now, and we're feeling those effects here in California and around the world. We in California are projecting some significant changes in our environment as a result of climate change, and this is just one example of where that heads with heat, for example. Significant new additional numbers of extreme heat days in the future, which have a direct impact on health, but also cascading effects through how our society operates and how land use will ultimately be decided in the future. This just kind of shows some of the examples. We've got flood, we've got infrastructure impacts, fire impacts. We have vector control issues, beetle infestations that are causing issues throughout California, caused in part by drought, in part by extreme heat, in part by low snowpack and water precipitation rates. So we go down the list, and there's the interactions, interrelationships between impacts and the sectors that those impacts connect to are things that we think about in our office, but other agencies in the state are also actively dealing with. Climate change is one of those things that really require us to work with partners that other issues haven't really needed us to reach out to those partners. So when we talk about local government land use, I'm a local government planner by training, and that was one of my first jobs. And working at the local government level as a planner, you don't typically interact with health officers and emergency managers and the like. And this conversation around climate change is causing a significant change in how we think about how we work with each other moving forward. And to that end, there's some fascinating new collaboratives that have formed to develop comprehensive strategies and networks for dealing with this issue, not just to create motivation for policy initiatives and program initiatives, but also to do peer sharing, peer knowledge sharing on how to get policies implemented. How do we move forward together on joint procurement activities or joint implementation of big policies that any one local government or any one organization trying to do by itself just wouldn't be successful. And so we've seen things emerge like in California, like the Alliance of Regional Collaboratives for Climate Adaptation, which has a number of regions around the state working together and then sharing information between regions as well on how to do more on adaptation, which has resulted in a great collaboration on other issues as well. Very excited about San Luis Obispo County's climate collaborative forming as well, and hopefully that'll be joining the ARCA network here in the near future. And California's climate change policy, we really have three buckets that we categorize things in, and that's not because these things are entirely separate issues, but it's because they have different responsibilities by different agencies. All of these things really work together, but different agencies lead these initiatives. So we have the emissions reduction side, which is primarily led through the Air Resources Board with support from all of the agencies in California through the Climate Action Team. We're preparing for climate impacts. The Natural Resources Agency leads up the Safeguarding California plan. But again, this is a multi-agency effort to work together to implement OPR through the Integrated Climate Adaptation and Resiliency Program is one of the primary resources for local initiatives on this issue. And then research, which is really critical to understand not just what the impacts are to California, but how do we move forward? What are the most effective policy and program initiatives? What are the gaps in resources and knowledge so that we can help fill those gaps in the future? We have 6 goals, we'll call them pillars, for working on climate change in California: increasing renewable energy, reducing petroleum use, doubling energy efficiency savings, working with natural and working lands to both reduce emissions and adapt to climate change, reducing short-lived climate pollutants, and safeguarding California through adaptation and resiliency measures. And this is really with the intention of both adaptation, but also achieving our longer-term goals of reducing emissions to 40% below 1990 levels by 2030 and 80% below 1990 levels by 2050. So what does all this mean in reality? It's a lot of numbers, a lot of goals. Well, we see it as, at its core, supporting compact and infill development for healthy and equitable communities. We're expecting to have over 50 million people in California by 2050, and we're at about 39 million now. So significant additional stress on our urban areas, but also land use and housing in general. Building a resilient and sustainable water system is critical. The drought has been very helpful in showing us some of the weaknesses in our system that need to be addressed proactively, thinking about the future and a changing climate. Steward and protecting our natural and working lands, not just for our own benefit and society's benefit, but also the natural benefits that provide. Incorporating climate adaptation into all planning and investment. This is part of Executive Order B3015, which passed in 2015. Governor signed it in 2015, basically requiring that all state agencies incorporate climate change in their considerations for policy and planning. And so that even includes pass-through money. So money that we would see going to local governments from the state or state-managed funds that are coming from other sources like the federal government would need to consider climate risk, but also emissions reductions in those thoughts. And then leading by example, really trying to be the proof of concept for a number of things. We're willing to take risks in California. Some other areas of the country and the world aren't willing to do. And so we're able to show proof of concept. And yes, we will see failures. But the hope is that through that leadership, we can inspire change, not just here, but in the U.S. and beyond. So just going through some of the adaptation resources that we have available. As mentioned, the ICARP, the Integrated Climate Adaptation Resiliency Program, relatively new, established by Senate Bill 246, required to be launched January of this year. So right now we have a basic program that's up online and supporting some resources through the Adaptation Clearinghouse. And then we also have a council, a technical advisory council that's providing feedback on how we need to develop resources and guidance materials internally. This is a great opportunity to stay engaged with the broader climate change discussion in California and the adaptation discussion. That's one of the only public-facing bodies that deal with climate change. A resources board on one side and the Technical Advisory Council for Adaptation on the other. So I encourage you to take a look at this and use the resources available on that website. And those will continue to be updated over time, including a number of case studies that will show that proof of concept that I was talking about earlier. And when it comes to adaptation, there's really only a couple of core resources, and then the other resources expand beyond that. When we look at the resources that we have the adaptation side and the emission side. On the adaptation side, the Adaptation Planning Guide really is our 9-step process for dealing with climate risk. And you can look more into that document there, and it shows how to do a vulnerability assessment, considerations about how to do outreach and support community engagement, how to prioritize those measures and implement and track those measures. And this was developed by the Natural Resources Agency and the Office of Emergency Services through a FEMA grant, and Cal Poly San Luis Obispo was the contractor on the project. So you guys have a lot of great capacity in San Luis Obispo for doing this type of work. And CalAdapt is really the vulnerability assessment starting point. So if you want to know what the impacts are in your community, take a look at CalAdapt, and it's a great starting point for this. We're going to continue to build out the resources and functionality of CalAdapt in addition to the Adaptation Clearinghouse, and they will work well together. And we're also looking at additional ways to expand the usability of the Adaptation Planning Guide and update that in the next year or two to respond to some of the new initiatives and policy efforts that are out there. Cool California on the emissions side is also one of the main resources for us in California. It provides links to a number of resources, background information, and a process for dealing with greenhouse gas emissions. We have a unique situation in California where we have the California Environmental Quality Act. So there's some specific requirements through CEQA that you need to take a look at if you were developing emissions reductions plan. And in San Luis Obispo, you guys have done a great job of moving forward on emissions reductions, climate action planning, and look forward to continuing to support the work that you guys are doing in SLO and supporting that effort. We've also at OPR been involved with the State Energy Efficiency Collaborative. That's a partnership that is funded through the California Public Utilities Commission to support local initiatives on energy efficiency. But as energy efficiency is something that connects to many other climate change related efforts, it's also become a great resource for more general climate change information. So if you're not engaged in this network, I'd strongly support you do that. It's a great asset, great network of people working on climate change and energy efficiency around the state, which, as many of you probably know, energy efficiency is one of those things that has a lot of co-benefits, not just reducing emissions, but also increasing resilience and capacity to respond to extreme heat events and extreme cold. The Seek ClearPath tool is one of those tools that we've worked to support so that there is a point of connection for local governments that want to do emissions analysis work, no cost emissions analysis work, and provides a process to do that. And again, there's additional guidance that's going to be coming through the general plan guidelines, which will be posted on Monday. We're very excited. This is the first announcement of that we're actually going to post on Monday, which is a very exciting thing for us because it's been about 5 years in the making. There's a number of other policy and resources available. A lot of these will be linked through the general plan guidelines, but they're also available online already through some of the work the Public Health Working Group has done for the Climate Action Team, work that the subgroup working on extreme heat, the subgroup of the Public Health Working Group has developed a Preparing California for Extreme Heat, a guidance and recommendations document, which is very helpful if you're looking at extreme heat and urban heat island issues. Climate Action for Health, a document developed by the California Department of Public Health to support conversations around health and climate action planning. Take a look at that. And the Energy Aware Planning Guide, a more generalized guidance document to support working on greenhouse gas emissions, but also adaptation and how that affects the energy sector. But as you all know, in the health sector, it has a cascading effect through some of these other issues. You know, when I talk about these resources, I haven't highlighted some of the health-specific resources are going to be talked about later. It's not because we don't think they're important. I just know that other people are going to be talking about them later in the presentation. So that's it for me. I think a couple of closing points is that this field continues to evolve. It always feels like things are constantly in motion and that there's change that's taking place, not only in the environment and what the science is showing us as a continually evolving scientific understanding of climate change, but also in how we implement the policy and programs that are being built around the state. You know, programs emerge and are implemented at different paces, and ultimately you look back at old guidance documents and you realize the policies and program guidance has already been updated, and you have to go back in and take another look. So I think those of us working in this field sometimes get frustrated at the pace of change, but also that's a really good thing because of a lot of great people are working on this issue and responding to the changes that we continue to hear on the science side and on what works from a policy side. And local and regional leadership is really critical for us at the state level to inform our policy and program initiatives. And your engagement as health professionals in collaboratives and policy initiatives, both at the state and national level, are also really critical. The California Department of Public Health and several organizations working with CDPH really helped bring health to the front of the conversation a few years ago on climate change. And now it's really integrated into everything we think about when we think about climate change and how to move forward. And so that's in a large part due to the networks that you're a part of and that you're supporting. So I encourage you to continue to do that. And for more general conversations on climate change or where you might be able to find resources if you're having trouble finding resources, you can go to the Integrated Climate Adaptation Resiliency Program as mentioned earlier, or you can feel free to email me or call me and I'll get you to the right place. Thank you again, and I will hand it off to the next presenter.
Michael, this is Kathleen. We're going to take like 2 or 3 questions. If you are a participant and you have a question, would you use the Q&A function on Zoom, and I will read the question out loud. So we've had one person ask, can we get a copy of the slides? Michael, can we get those slides to post on our website?
Absolutely. You already have them in your box.
Okay. Thank you very much. Any other questions for Michael before we move on? Doesn't appear right now, so we will move to our next presenter. Our next presenter is Meredith Millett. She's an epidemiologist with the Climate Change and Health Equity Program in the Office of Health Equity at the California Department of Public Health. Her topic is adaptation tools for local health departments. In her work, Meredith focuses on the health effects of climate change and related policies. She was previously an epidemiologist for the asthma program at CDPH and has worked as a biostatistician at Children's Hospital Oakland and UC Berkeley. Meredith has her MPH in epidemiology and biostatistics from UC Berkeley. And with that, Meredith, I'll turn it over to you.
Great, thanks so much, Kathleen, and thanks, Michael, for that presentation. I'm glad to be here today. I'm coming to you from the Climate Change and Health Equity Program of the California Department of Public Health. And in our program, we work on increasing health and equity in California's climate-related policies and activities, as well as increasing the focus on climate change and equity within public health work. And today, I'm going to talk to you about some tools that we've developed through one of our programs, the CalBRACE program, or California Building Resilience Against Climate Effects. California Department of Public Health is one of 16 states and 2 cities funded by the CDC's Climate Ready States and Cities initiative. This funds the CalBRACE project, which uses the CDC's BRACE framework, which is outlined here on the right in the wheel. It's a 5-step process that helps state and local health officials develop strategies and programs to prepare for the health effects of climate change. And the goals of the project are listed here on the left. CalBRACE works to enhance public health department capability to plan for and reduce health risks associated with climate change. At our CDPH Climate Change and Health Equity Program, we focus on doing this by improving living conditions that increase community resilience to climate change. CalBRACE has created resources and carried out a variety of activities related to climate change adaptation and health, and many of these are available on our website. The 3 resources on this list are the ones that I'll outline in more detail in this presentation. Number 1 is the Climate Change and Health Vulnerability Indicators for California, which provide local data on climate change exposures and conditions that impact health. Number 2 is the Climate Change and Health Profile Reports, which are summaries of climate and health information and data for each county in California. And number 3 is coming soon, a template presentation for locals to use information from the indicators and reports that are in number 1 and number 2. CalBRACE has also done a lot of work embedding health and equity into safeguarding California. Yeah.
Meredith, can you speak up a little bit? We've got a few the questions saying that they can't hear you.
Maybe move the
Sure.
mic closer. Yeah.
Thank you.
California has that. So I guess I'll find out.
Yeah, that sounds a little better. Yeah, thanks.
Oh, okay. We've also done a lot of work embedding health and equity into Safeguarding California, which is California's state climate change adaptation plan. Michael mentioned it. And we have worked with 13 local health departments to build capacity and create community-specific resources to support health as it relates to climate change. In particular, a number of counties have done assessments to inventory what is going on in their county around climate change and then use that information as a needs assessment for next steps and actions. First, I want to tell you about the climate change and health vulnerability indicators for California. These were developed by the CalBRACE program in partnership with staff from local health departments across the state, as well as our partners in the Environmental Health Investigations branch of CDPH. So there are a set of indicators pulled together in one place that can help define the scope of climate impacts and identify the populations and areas that are most vulnerable to these impacts. The indicators are split into 3 domains. The first is environmental exposures. These include extreme heat, air quality, drought, wildfires, and sea level rise. And then there are indicators to identify the populations most vulnerable to those environmental exposures, the ones I just mentioned, such as the very young and very old, people working outdoors, and people who have fewer resources to adapt to climate effects. These are social assets or resources that impact resilience. They include education, vehicle ownership, health insurance, and others. And socioeconomic characteristics such as racism and poverty also impact resilience to climate change. The third category is adaptive capacity. It includes indicators that measure the capacity to moderate or cope with environmental impacts, such as how air conditioning and tree canopy can help cope with heat. And together, all of these indicators are compiled across these 3 domains to help with prioritizing resources and programs for the most impacted and vulnerable communities. So the indicator data are provided on the CalBRACE website in Excel files. They're provided at multiple geographic levels from the state down to whatever is the smallest available. They're all at least at the county level, and most of them are at the census tract level. And many of the indicators can also be stratified by race or ethnicity, and that information is in the Excel files on the website as well. The data all come from publicly available sources, and the steps for creating the indicators are all transparent, and they're put into the accompanying narratives. These narratives also explain the data sources, how to use the data, and why each indicator is important for climate change and health. This is just an example of what it looks like if you go to our website to download it. It has the Excel files and the narratives. And the Excel files also include data dictionaries, and you can filter and sort however you need to. And like I said, they also have these accompanying narratives. They provide information about the data and where it comes from, and why it's relevant, and they also have sample graphs and charts that you can create from the data. We will also soon have state maps available for each indicator. These will map the county data for better visualization of geographic trends, and in the future, other resources will map data by census tract. I'll talk about those later in the presentation. So the second resource I want to talk about today is the Climate Change and Health Profile Reports. There's one for each county in the state. They include data and maps and charts to outline climate projections and conditions that make people more vulnerable to climate change. The reports can be shared as they are or used to create other resources for other specific audiences. Each county profile report includes background on climate change, climate projections, overview of the health impacts of climate change, description of the most vulnerable populations in that county, and data on health inequities and vulnerable populations in the county. They also have strategies and action steps. And again, these are a starting point. In your local area, you can kind of use your local knowledge to adapt and translate them into what's most relevant to your community or whatever audience you're approaching. So this slide outlines the connections between climate change and health across many areas. And this type of information is provided in the Climate Change and Health Profile Reports. It's important background on the full spectrum of health impacts related to climate change. So local data aren't available for all of the health impacts on this slide, but it's still good to continue to keep them all in mind nonetheless. For example, if you use these resources to communicate with community members or decision makers, the general background on climate and health is included in there for you to reference. The reports include climate projections by climate region. The regions are defined by the California Climate Adaptation Planning Guide. For example, San Luis Obispo County is in the Central Coast region, where if we don't curtail carbon emissions, we expect July temperatures to increase by 4 to 7 degrees Fahrenheit by 2100, rainfall to decrease by 3 to 4 inches, and the number of heat waves per year to increase by 8 to 10 additional heat waves. This is an example of both the data that's included in the report as well as one of the slides in the PowerPoint template that you can adapt for local use. And this is an example of the heat information that's in the reports, the data from CalAdapt, which Michael mentioned too. This shows that the projected temperature in San Luis Obispo County will increase by 3.1 degrees by 2099 under a low emission scenario. That's a scenario where we reduce emissions aggressively. In a high emission scenario where we continue with business as usual, we may see up to 5.1 degrees increase in temperature in the county. And another example of information in the reports, this time the data is from CAL FIRE. This map shows current fire hazard severity zones. The cream is the moderate severity, orange is high, and red is very high. The reports also outline vulnerabilities in the community. These are just some examples taken from the report. There are many other data points. So in San Luis Obispo County, 23% of low-income residents have unreliable access to sufficient, affordable, nutritious food. 43% of adults have multiple chronic conditions. 66% of households are estimated to lack air conditioning. 8,888 residents are outdoor workers, and 23% of residents live in high-risk wildfire areas. These data can be used and presented in various ways to make it easier for an audience to understand how many people in the county are more vulnerable or resilient to climate impacts due to socioeconomic and health conditions. For example, if your public health program focuses on children and you're advocating for that population, you can pull out the relevant health and population statistics, like the number of kids under age 5, or perhaps the number with asthma, poverty and food insecurity, things that affect that population the most. And there's a variety of information in there to help you identify and communicate to different priority populations, or to find what's relative to your community or advocate for a particular program. So that leads me to the next resource. We've created a template PowerPoint presentation that provides slides presenting a variety of information from the indicators and the profile report. The slides can be used as is by inserting data from your particular area, or they can serve as a starting point for background when creating your own resources. They're intended to be a toolkit of slides to choose from and add to. And I want to give special thanks to Durrett English and Gurjeet Kaur Singh, who developed the PowerPoint template slides. And here are a few examples of the template PowerPoint slides that can help you tell the story with data. Most of them, like this one right now, use the Bay Area region as an example. So this is one of them with the climate projections. And this slide looks at the extent of outdoor workers in the county and stratifies that by race ethnicity. Another example of what can be done, and it can be done with other indicators as well. And this one is an example of summarizing the data at a smaller geographic level, in this case showing the violent crime rate for different cities in Alameda County. This can also be done with other indicators as well. So again, these are the resources that I've just introduced and the website again. Everything I've shown are examples of how they can be used, and you can also contact us for other examples of how counties have already used these resources. Counties have used them as background for conducting more in-depth assessments. They've used them as background for educating community members prior to getting their input on how to address climate change, and as data to advocate for programs and policies, and they can be used in many other ways. So now I want to move over a little bit and tell you about some additional resources for climate adaptation and health. First, our partners here in CDPH at the California Environmental Health Tracking Program, they provide a lot of resources on climate change and health, including an online data query system to find data on heat-related illnesses and deaths. In fact, heat illness data from the tracking program are included in the CalBRACE County Health Profile reports. The second is the CDPH's Healthy Communities Data and Indicators Project, which provides data and standardized measures related to social determinants of health. Many of the climate change and health vulnerability indicators for California that I talked about earlier are already part of the Healthy Communities indicators because many of the same root causes of general health disadvantage overlap with the root causes of climate vulnerability. So this is another tool for identifying vulnerable communities. And the website link is really long, so I put it in, but if you Google that or search for it on the CDPH website, it's pretty easy to find. There are 2 more resources that will be coming soon. First, CDPH is working with the Public Health Institute to develop a local health department guide to integrating climate change and health equity into traditional public health programs and core functions. It will outline the linkages between climate change and essential public health issues, things like maternal, child, and adolescent health, chronic disease, injury prevention, infectious disease, and others. And it will also describe the current state and regional and local climate activities and how local health departments can participate in them. The last is the resources that will be presented in the 3rd webinar of this series, so I think on August 2nd. It's the California Heat Assessment Tool that's being developed by 427 Climate Solutions. It's being done as part of the California 4th Climate Change Assessment. And the HEAT tool is a decision support tool that helps in planning for extreme heat in the future. You'll hear more about that next week, but I wanted to mention that this tool will also incorporate many of the climate change and health vulnerability indicators for California that I talked about today. The last tool I want to tell you about is a resource called the Health Disadvantage Index from the Public Health Alliance of Southern California. The Health Disadvantage Index is an interactive online data and mapping tool. It allows users to easily visualize the conditions that shape health in each neighborhood in California, and it provides census tract rankings across the state. It can be used to target funding, policy, and other interventions to maximize impact and ensure that everyone has what they need to be healthy. The Public Health Alliance of Southern California will release a new version of the tool this fall. You can still go look at the old version, but the new version will have a new name called the Healthy Places Index. It will have updated data and analysis, a new map interface, and an accompanying policy guide to assist jurisdictions in improving health conditions. And I'm highlighting it today because with that new update, it will also include the climate change and health vulnerability indicators for California, and it will visualize them at the census tract level. As I mentioned earlier, the risk factors for health disadvantage overlap with the risk factors for climate vulnerability. So many of the climate change and health vulnerability indicators are already part of this tool, but with the update, the remaining indicators will also be made available on this site, and they can easily be visualized in maps at the census tract level. So I encourage you to keep an eye out for the updated version. I encourage you to visit this site and all the other resources that I mentioned earlier. And I just want to end on the note of kind of how to motivate and strive for the solution in addition to outlining the problem. The county health profile reports also contain strategies to increase resilience to climate change impacts, some of which are listed here, like educating, empowering, and engaging residents and businesses, promoting community resilience, promoting strategies that not only affect mitigation and adaptation, but also have public health benefits, working in a multi-sectoral way, conducting research, and implementing policy changes. So that's an overview of our tools. Please feel free to contact me or other CalBRACE staff with any questions. And here again are the website links. And thanks so much.
Thank you very much, Meredith. We do have a few questions. My friend Linda Rudolph asked one last time, and Michael had already gotten off. So if we can let Michael come back on, maybe he can answer this one. Linda wants to know, how can people work to ensure that urban heat island mitigation with transit-oriented development and infill? So Michael, do you have a thought on that?
I guess I didn't quite get the full meaning of the question. So what resources are available to support?
Well, how can people work to ensure urban heat island mitigation along with things such as transit-oriented development and infill? So when you've got these developments going on and you're trying to mitigate the heat from the urban heat islands. Yeah, any thoughts?
Yeah, absolutely. And I think this is one of the things we run into when we think about how to holistically deal with climate change, but also our health issues and wanting to get people on the street to ride their bikes and get out of their cars and access resources a little bit differently. Urban heat island causes, issues around comfort, but also a longer term health impacts, and they can be mitigated through a number of different ways, but they also have co-benefits, and it has to be balanced with other priorities. So when we talk about urban greening, it's a fantastic way to deal with urban heat island, particularly for pedestrians and for the sides of buildings. But if we don't do that urban greening properly, it could cause shading of solar panels, or it could create much more significant water use, which goes counter to other goals and priorities. So using native plants like that. One of the other things to do would be to really maximize energy efficiency programs, retrofits, to make sure that there's additional insulation and ability for buildings to not only be more comfortable inside without air conditioning, but also air conditioning causes a direct release of heat into the urban environment. So there's a number of direct sources of heat that aren't related to the sun, that are related to just how the urban environment operates. So reducing those direct sources of heat can be really helpful. Cool roofs, cool materials, cool paving. There's a number of materials now available and currently in testing, for example, by Caltrans, to support a cooler urban environment. So working to support those cool materials. For example, Los Angeles now requires cool materials on roofs, and commercial buildings also require cool materials and have for a while. And the other piece of this is the new Title 24 standards, which are the energy efficiency standards for the state of California, are going to require zero net energy buildings starting in 2020 and phased in through 2030. And this is a really exciting opportunity to look at not just how do you build a building, but how do you put it on a site? How do you relate it to the rest of the urban environment? So there's certainly going to be a multi-decadal transition in how we get from where we are now from an urban heat island context to where we are in the future. You can't plant mature trees right now, but being able to keep them alive and support them, plant natives, and think about what the climate's going to be like in 50 years when we think about what our trees are that we're planting is also an important aspect of this. There's a lot more information in some of the resources that I put forward, and also on the climate change portal, climatechange.ca.gov. And we'll be continuing to be placing materials on the Adaptation Clearinghouse website, on the OPR website, which should be continuing to be updated over the next year or so.
Thank you, Michael. Another question, will Meredith's slides be posted? Yes, we'll post everyone's slides, so just so you know. Meredith, an easy question for you, or I think it's easy. Are there climate change and health profile reports available for the 3 local health departments, Berkeley, Pasadena, and Long Beach, or are they only at the county level?
No, unfortunately, they're only at the county level.
Okay, thank you. And then one more for Meredith, and then we're going to move on, and then we'll come back. There's some really good questions here. We'll save time at the end. But Meredith, how would you say CalBRACE health vulnerability indicators integrate with CalEnviroScreen?
That's a really good question. There are a few things in both that overlap, but I think CalEnviroScreen creates an index, so it puts together a bunch of indicators, and it has a little more of an environmental focus, like with the air pollution and other environmental exposures, and it creates this index that ranks everyone by weighting all the different factors. The indicators, we don't have an index of the climate change and health vulnerability indicators. They're just all there for you to look at on their own. Although when they are integrated into the health disadvantage index, or what's going to be called the Healthy Places Index, you will be able to sort of overlap them on the maps a little bit to see where some of the indicators, what areas have kind of high vulnerability for multiple indicators, but it still won't be in that sort of an index. And I think the CalBRACE indicators bring in a few extra population sensitivities and some overlap, but go in a little bit different direction than CalEnviroScreen.
Thank you. Next week, Dr. Gina Solomon will be talking about the CalEnviroScreen. So be sure and come back if you're listening next week, and we'll get some more information on that. So with that, we're going to move along to our third speaker, and we'll come back to some of these questions at the end. Our next speaker is Matt Wolf. Matt Wolf is a health data and geospatial analyst with the San Francisco Department of Public Health's Climate and Health Program. His topic is using tools for climate health adaptation at the local level. Matt has experience using data indicators and mapping tools to develop climate health vulnerability assessments, and he has authored the San Francisco Climate and Health Profile, the San Francisco Flood Health Vulnerability Assessment, and the San Francisco Climate and Health Adaptation Framework. And with that, Matt, it's yours.
Hi, everyone. I'd just like to start by thanking Kathleen Carley for the introduction, and you and the San Luis Obispo Department of Public Health for putting on the webinar series. Just to reiterate, my name is Matt Wolf, and I'm a health data and geospatial analyst with the San Francisco Department of Public Health's Climate and Health Program. And I know that I was inspired by Michael and Meredith's presentations, and I'm excited to start incorporating some of their tools and case studies into our own work here in San Francisco. And I hope I can add to the discussion by just sharing a few of the tools we've developed to help facilitate the planning, implementation, and evaluation of local level climate health adaptations. So I'd just like to take a moment to walk you through the structure of this presentation. As you know, there's no one-size-fits-all approach to climate health adaptation planning. So before I discuss a few of the tools we developed, I think it's important to discuss the particular context that we operate in. So I'm going to begin by giving a brief background about the San Francisco Department of Public Health and our Climate and Health Program. And then I'll jump right into discussing a few of our tools, and that's specifically the Climate and Health Adaptation Framework and the Climate and Health Intervention Screening Matrix. So the San Francisco Department of Public Health's Climate and Health Program was established in 2010, and like Meredith's presentation and the state of California, we are a BRACE program. We are one of only 2 local health departments to receive BRACE funding from the CDC's Climate Ready States and Cities Initiative, the other being New York City. The Climate and Health Program sits in the San Francisco Department of Public Health's Office of Policy and Planning, which gives us access to both of the divisions of the San Francisco Department of Public Health. Those divisions being the San Francisco Health Network, which includes 2 hospitals and a network of primary care and behavioral health clinics, and our Population Health Division, which houses programs like consumer safety, environmental health, and some of our surveillance programs. Since 2010, much of the work of the Climate and Health Program has been data analysis, literature reviews, and the development of tools to support vulnerability assessments. But we've also worked with our Public Health Emergency Preparedness and Response Program to develop some outreach and engagement materials and hazard-specific emergency plans. And I think one more important thing to mention with regards to the San Francisco context is that San Francisco is both a city and a county, and that kind of sets us apart from a lot of other jurisdictions doing this work. And our work often depends on the coordination and collaboration with other city departments engaged in climate adaptation. And these have included the Planning Department, the Public Utilities Commission, our City Administrator's Office, and the Department of Environment. So the success of our initiatives is often predicated on working lockstep with a lot of other citywide processes. So it's in that political context that we developed the Climate and Health Adaptation Framework. The framework builds upon the work that we've done previously, builds upon the vulnerability assessments, and represents an evolution of our program's focus from trying to understand risk to proposing strategies to mitigate that risk. The framework was released last March, and just really broadly, it identifies and assesses how climate change will impact public health in San Francisco and our department's ability to protect and promote health. It proposes adaptations to respond to these health impacts and indicators to measure the severity of the climate risks and evaluate the success of the adaptations. Lastly, the framework identifies strategies to facilitate the collaboration with internal and external stakeholders. And to the left of this screen is the structure of the climate health adaptation framework. And I thought I'd just kind of walk through the three main components, which are the review of vulnerability assessments, climate risks and responses, and an assessment of public health preparedness. One thing that I've mentioned a couple times in this presentation, but I want to emphasize, is that the climate health adaptation framework builds upon a lot of our previous work, especially our vulnerability assessments, and that this tool is intended for local health departments who have already established somewhat how climate change is expected to impact their jurisdiction and which populations are especially vulnerable to those impacts. So these are our climate projections, and I'm going to run through this pretty quickly. This is by no means an exhaustive list, but I'd like to focus on extreme heat for a second, because it always surprises people that San Francisco is particularly susceptible to the health impacts of extreme heat. In San Francisco, we define an extreme heat day as any day with a temperature in the 98th percentile, and in San Francisco, that's 85 degrees. We currently have about 5 to 10 of these days per year, and that number is expected to increase up to 40 by 2050 and 90 by 2100. And we're particularly susceptible to the health impacts of extreme heat, because as a temperate city, we're just not that used to this type of weather, and our bodies have a more difficult time thermoregulating, and our housing stock was not built for warm temperatures, and most of our homes don't have air conditioning or other cooling features. And of course, the most impacted are those who live in places either with poor housing quality or in urban heat islands. And I know it's like fogged in here, but one of our challenges is trying to convince people that extreme heat is actually a major health impact in San Francisco. Just really briefly, we're a peninsula, and so most San Franciscans either live, work, or play in close proximity to the coastline, and we expect sea levels to rise by 24 inches by 2050 and 66 by 2100, and in a 100-year storm could add an additional 42 inches on top of those numbers. Like most of California, our precipitation is expected to oscillate between wet and dry extremes. In wet seasons, extreme storms can increase household dampness and mold, which could lead to increase in rates of respiratory illness, asthma, and allergies. And extreme storms could cause health impacts associated with power outages. In dry seasons, we're susceptible to droughts like most of California. And although we don't project any wildfires in the city proper, in adjacent county that would cause air quality concerns as smoke would blow into our jurisdiction, and all of these hazards impact public health. So as I mentioned before, the framework builds upon the previous work of the Climate and Health Adaptation Program. And this is specifically our Climate and Health Profile, which is an all hazards vulnerability assessment, and hazard-specific vulnerability assessments, which are, you can see below, include our extreme heat vulnerability assessment and our flood health vulnerability assessment. And these are both available on our website, which is sfclimatehealth.org. And I'm not going to go into these in too much detail, except to say that they were important because they helped us develop a social determinants of health framework to assign risk, because they used health indicators such as asthma rates, environmental exposure indicators, infrastructure indicators such as housing quality and impervious surface, and socioeconomic indicators such as race, income, age, and educational attainment to understand how climate health vulnerability was distributed in San Francisco, which neighborhoods were most vulnerable, and how we should allocate resources and plan interventions. So the actual adaptation framework builds directly upon this, and this is why we thought Section 1 should be a review of our vulnerability assessment. So that moves into Section 2 of the framework, which is climate risks and responses. And this is intended to be kind of the meat and potatoes of the framework. This section is divided into these 8 different climate risks: vulnerable populations, extreme heat, air pollution, waterborne illness, foodborne illness, vector-borne disease, wildfire and drought, and extreme storms, sea level rise, and flooding. And these were developed and chosen to align with the climate risks identified in the Obama administration's 2016 climate health assessment. For each climate risk, we established baseline conditions that explored the current status of that climate risk in San Francisco, how socioeconomic factors, health factors, exposure factors, and infrastructure factors may modify that risk, and which populations were particularly vulnerable. So for the climate risks that we had worked on with our vulnerability assessments, we leaned on those vulnerability assessments a lot. The map you're looking at is from our Climate Health Profiles Community Resilience Index, which is an all hazards approach to community resiliency. And we use that to explore the baseline condition for the vulnerable population's climate risk. For climate risk not covered in our vulnerability assessments, such as vector control and vector-borne disease, we were able to leverage our connections within the public health department to bolster our knowledge base through informant interviews. So once we established baseline conditions, we moved to strategies for consideration. And this section, we proposed actual adaptations and interventions. These strategies were developed after review of academic literature, local, national, and international best practices, and key informant interviews with San Francisco Department of Health employees. So overall, we ended up with about 100 different adaptations and interventions, and we pared it down to about 45 for the framework. And we cast a very wide scope when we're looking for our adaptations and interventions. And we thought that this reflected the fluid role of public health and local climate change adaptation. So different adaptations and interventions included the development of education and outreach materials, facilitation of work groups, interdepartmental collaboration and collaboration with community-based organizations, the deployment of data tools and innovative technology, curriculum development and training, and planning and program development. And these adaptations and interventions, we stressed this, were not meant to be prescriptive. We didn't want to bring this document to other departments or to programs within our own department and say, do this. We viewed this as a starting point to engage programs within our department and other departments on the development of adaptations. We don't expect the final adaptations to mirror our proposed ones exactly, but just the beginning of an iterative process to increase capacity and collaboration. Lastly, in the climate risks and responses section is the climate risk health indicators. And these were to evaluate the severity of the climate risk and the impact of the interventions. And we thought that this was important to kind of build in evaluation into the framework. These indicators come primarily from our previous vulnerability assessments, but also from reports from the Center for State and Territorial Epidemiologists and the Agency for Healthcare Research. We know that there's a lot to be done to refine these. They're not normalized by exposure, and it's the nature of climate change adaptation that it's easier to do process evaluations than outcome evaluations. But these indicators, we thought, provided a good starting point to establish a tracking system to understand the impact of adaptations and interventions. So the last section of the climate and health adaptation framework was the assessment of public health preparedness. This section began with an assessment of our public health department's strategic planning documents. So we went through about 5 or 6 strategic planning documents, including our healthcare services master plan, our community health needs assessment, and our population health division strategic plan. And we wanted to see how these documents reference climate change or reference health outcomes that would be affected by climate change, or populations particularly vulnerable to those health outcomes. And the purpose of this exercise was to see how we could incorporate climate health adaptation more officially into the structure of the department. So we would be able to advocate for future climate interventions and increase the capacity of the department. One other cool thing we did in this section was develop 2 different surveys that we gave to the San Francisco Health Network and the Population Health Division. And these surveys examined the extent to which management believed in climate change. And in San Francisco, we had most of the people believe that climate change exists, but there was less buy-in that it exists now. There was some thought that it was a future problem. We surveyed whether people believed that climate change would impact the city broadly or the populations they served. We surveyed whether they understood how climate change is connected to public health and had the knowledge and resources necessary to implement adaptations and interventions. And a lot of the information from this survey helped us develop some of the adaptations and interventions proposed in the previous section. So this was really informative as we kind of develop a more nuanced understanding of how we can proceed with adaptations and interventions going forward. As a companion tool to the framework, the Climate and Health Program developed our Climate Health Intervention Screening Matrix. So this is an Excel-based tool and it's not available yet on our website, but if you send me an email, we can send it out to you. We're still in the process of refining it. The tool is intended to help local health departments prioritize adaptations and interventions based on a few established principles, including equity, impact, and feasibility. So there's 6 steps, as you can see in the very color-coded bar to the left, and I'm just gonna walk through it pretty quickly. The first is that the department uses their vulnerability assessments to identify climate risks and health outcomes and rate their severity. So for example, in San Francisco, extreme heat and heat-related illness would be severe, while blizzards would probably be less severe. And then section 2 is set local capacity and planning priorities. So it asks you what the time frame is for your planning and implementation of your adaptation and what resources are available. Once those are established, step 3, you evaluate the actual impact of a project. So you go through and say, I want to develop this adaptation. And then it asks you, are there academic research in support of that project? How effectively does that project target the primary health outcome? How much is health burden reduced? Are there equity impacts? And it asks you a series of impact questions. And then you evaluate the feasibility of the project. Is there how long would that adaptation take to plan and implement? How much does it cost? What partnerships are necessary, either through city departments or through other community-based organizations? And then to the right, you can see our final summary report. Everything is summarized. And once again, this isn't meant to be prescriptive. There's an aggregate impact score, but we view this more as a logic model to kind of guide our thinking about opportunities and challenges associated with the development of different projects at the local level. And it incorporates equity pretty significantly into the analysis. It's a way to flesh out proposals. So lastly, I thought it would be good to show you how we've used these tools to kind of forward our programmatic activities. And so these are some of the projects that we've begun to scope that were identified through the framework in the screening matrix. And so they include the development of more sophisticated print materials to draw the connection between climate change and public health. Based on our survey results, we want to develop clinician training modules for physician and nurses in the climate and health, the San Francisco Health Network, to kind of give them tangible, to like first paint the picture about how climate change and public health are connected and how their populations will be impacted, but like give them tangible asks about how to approach climate change with the patients they see, and to kind of draw the connection between the healthcare sector and sustainability. And then finally, we're just beginning to scope how we can look more closely at the health impacts of power outages, because we found that that was a pretty significant health impact that we had done relatively less on. And so we're just kind of figure out how that looks. And we're using this tool to start conversations with other city departments to kind of scope what that project would look like. So the Climate and Health Adaptation Framework, just in summary, has been a valuable resource to begin these departmental and interdepartmental conversations on climate and health adaptation planning. And so that's it. And everything is available on our website, which is sfclimatehealth.org. And that includes our vulnerability assessments, some interactive maps and other tools, and our climate health adaptation framework. And I'm available if you ever need to email to ask any questions about anything. Thanks.
You're live.
So thank you very much. We're looking for questions now specific for Matt. I don't see any questions specific for Matt. Let's see. No, nothing yet, huh? So maybe what we'll do is you guys can get busy typing in your questions for Matt. We'll scoot over to Michael, let Michael do his presentation, and then we'll come back and try and catch up on the rest of the questions, because we do have about eight questions here.
Okay.
Michael, are you live? We were having a little problem getting Michael hooked up, so.
So you just need to unmute his mic and he'll be good.
So I'll start Michael's introduction, and we'll see if we can get Michael on the live. So Michael Kent has been the ombudsman for the Contra Costa County Hazardous Materials Program for the past 19 years. His topic is developing a system to refer public health nursing patients for weatherization services. Michael's job is to respond to questions and concerns and to serve as a resource on the environmental pollution for county residents. He also staffs the county's Hazardous Materials Commission, an advisory body to the County Board of Supervisors, and provides support to public health on issues such as environmental justice, air pollution, and climate change. He is co-chair of the Bay Area Regional Health Inequity Initiative's Built Environment Committee. Michael received a Bachelor of Philosophy in Interdisciplinary Studies from Miami University in Oxford, Ohio, and a Master's of Environmental Studies from Evergreen State College in Olympia, Washington. Is Michael ready?
He's here and he just got to get his audio connected. So stand by.
We've got Michael listening. We just can't get Michael talking yet, right?
Right.
So we're going to give a minute to try and catch this up and see what we can do. Well, we could go back to Q&A, but it would be the other. So I'm going to read some questions. Matt, Michael McCormick, or Meredith could answer. We'll start with the first one I've got up there. Let's see. Are there any international examples that California looks to when developing policies and programs, considering California is such a large economy? Michael McCormick, you want to take a stab at that?
Sure. Yeah, we have international relationships around the globe. We're working with folks on adaptation and greenhouse gas emissions reduction. We have MOUs with dozens of countries. Most recently, we've really increased our engagement with China on some of their air quality and health issues, with a fantastic co-benefit of significantly reducing greenhouse gas emissions. And we've traditionally worked with a number of other Mediterranean communities around Mediterranean climate areas around the world, Chile, Italy, Australia. In particular, Australia has been helpful in looking at drought and some of the impacts from extreme heat. There's work being done by almost all of our agencies with international partners, so it's hard to capture them all here. But we, yes, we're looked to as a leader and sort of a tip of the spear on a lot of policy initiatives, but we are learning a lot from our international partners that are also working on these same issues. So it's certainly a two-way conversation.
Okay, we'll do one more question, and then it looks like we've got Michael. And this is for Meredith. Meredith, do the indicator tools include proximity to major polluters such as industry, freeways, freight, incineration?
No, these indicators don't include that. They do include some air quality measures, but not proximity to those sites. I think, to follow up on the previous question, I believe that might be something that's included in CalBRACE.
Okay, thank you. Okay, I think we've got Michael Kent now.
Yes. Hello, Mike.
Hi, can you hear me?
Yes.
Okay, good. Sorry about that. So thanks for the opportunity to be part of the webinar to talk about just one program that we're trying to implement this year. And the concept of the program is really simple. It's simply linking the patients in our public health nurses with weatherization services. But you know, implementing it's got many moving parts and requires a bit of coordination. So what I'm going to try to do is describe the efforts we've undertaken to make it run as smoothly as possible. But first, I want to jump ahead a little to the middle of the story to talk about an encounter that I had that really drove home for me the true meaning of a couple of the key concepts that we've been talking about today that frame our climate change work in a really concrete way that I don't think a PowerPoint can really do justice. And, you know, it gave me an opportunity to reflect on those concepts and, you know, reconfirm to me the value of this project. And the first concept really is one we've talked about, you know, that the impact of climate change is going to disproportionately impact vulnerable populations already suffering health inequities. And it's a phrase, you know, that's very familiar to everybody here. And the second is, you know, that one of the primary ways we try to reduce health inequities is by focusing on the social determinants of health, mainly social and institutional inequalities, living conditions, and represented in this slide by a chart developed by BARHI, the Bay Area Regional Health Inequities Initiative, with help from many others. And don't worry, I'm not going to try to describe this chart. I just put it up as an illustration that, you know, social determinants of health is what we work on. And so the importance and the true meaning of these sort of concepts were driven home to me in a very real way when I met a gentleman named Leonard, who's a public health nurse patient that I helped fill out his weatherization application. And I want to talk a little bit about Leonard and that encounter. He lives in a very modest one-bedroom apartment in Antioch, which is a city in eastern Contra Costa County. And when I went in and met him, my first impression when I met him was that he was a very frail 70 to 75-year-old. And then and when I started talking to him, as it may sound, what struck me most is what he and I had in common. You know, when I came in, he was hooked up to a respirator. He has COPD, and you know, I have asthma. He recently had back surgery, and I've had back surgery and a life of back problems. He looked like he may have had diabetes, and I have diabetes. And so, you know, I was at first struck by what we had in common. But then, you know, when I found out he's actually not 70 or 75-year-old, he's only 58 and actually a few weeks younger than me. And, you know, so that the harsh reality of our differences and the impact that the social determinants of health have on our health really sunk in for me when I learned that. And, you know, some of our differences, I think, are stark. I'm white, he's black. I was raised in a solidly middle-class home, was an Eagle Scout, kind of literally and figuratively, and have a master's degree. I don't know all of Leonard's history, but he hinted at he spent some time in jail and had a background of drug abuse. I own my own home. He came to the apartment he was in straight from one of our homeless shelters. I have a steady job and good health insurance, and I'm reasonably well functioning. He's permanently disabled, living off $1,000 a month in various benefits. And so, you know, it's no wonder then, given our different backgrounds, that our similar health profiles resulted in very different outcomes. And when it was hot one day in the week before I met him, Leonard ended up in the hospital because the apartment he's staying in the best thing they could find for him in the Bay Area's incredibly tight and expensive housing market, didn't really have air conditioning. And the summer temperatures in Antioch can exceed 100 degrees, excuse me. And so the week before, when it was really hot, he ended up in the hospital. So again, that just really struck me in a real way, these things that we talk about often in a very abstract way. But let me go back to the beginning and the thought behind connecting our two programs, the public health nurses and weatherization. And the thought was that it could be mutually beneficial for both. We knew that weatherization could help medically vulnerable low-income people and their families. It lowers energy usage, which not only helps reduce carbon emissions and air pollution, but helps people be more resilient because it helps keep homes cooler in the summer if they don't have air conditioning, or if their air conditioning goes down in a power outage, and more comfortable in the winter. It also makes alternative energy options more viable. It can reduce energy bills, which for people living on the margins can free up money for necessities such as food and medicine. It can help keep out particulate matter, making air easier to breathe for people with respiratory problems. And finally, it helps keep out moisture, which can reduce insect pests and mold, both of which are asthma triggers. So that's how it could help on the medical side. But we also knew it would help our weatherization program, which is housed in our planning department and receives funding mainly from the Department of Energy. Even though that program is income qualified, that is, you have to have a certain low income to be able to take advantage of their services, the people in the program told us they didn't feel they were really being helped, but they were really helping the people that needed it the most. They were starting to see a lot of repeat customers, people they had already provided services for who were just coming back, mainly to get their light bulbs changed or something. And they just didn't feel like they were reaching people who needed it the most. So the question for us then became, if we want to reach medically vulnerable people, how to do that, how to identify the most medically vulnerable low-income people and get them to apply for the program. And this is where our public health nurses come in. In Contra Costa Public Health Department, we currently have 45 public health nurses in 3 different pools. We have nurses that focus on perinatal issues. We have nurses that focus on pediatric, and then nurses that focus on adult populations. And they conduct about 20,000 home visits per year to approximately 3,000 clients in all those age groups. So we thought, what better way to identify medically vulnerable people that might benefit from weatherizing their homes or rental units than by going through the nurses. So we approached our public health nurses to see if they would be interested in being our eyes and ears in these homes. And to our delight, they were very interested and immediately saw how the program could help their clients. So I began making presentations to the nurses with the manager of the weatherization, the county's weatherization program, to explain how the program works and how they could identify their clients who might benefit and fill out their application. So at the same time, approximately the same time, the State Department of Public Health Climate Change Program was also interested in this concept, and we're interested in seeing how we could coordinate these programs with the nonprofit group called Build It Green that had received weatherization funding from the state's cap and trade program. So we thought that would be a great idea. And so California Department of Public Health is funding a local nonprofit called RAMP, which stands for the Regional Asthma Management and Prevention Program, to facilitate the coordination of these efforts and to write up the process and our lessons learned as a case study for the other counties in the state. So the way the program is going to work is, so the nurses, public health nurses, when they go to visit, will either refer clients to me or to help them fill out their applications, or directly to the county weatherization program to help them fill their applications, or if they want to, and a couple of nurses have done this, help them fill out the applications themselves. Unfortunately, the applications are a little complicated, and so it really helps to have somebody help people fill them out especially people who might be medically vulnerable and have difficulty. Then our weatherization program is going to coordinate with the nonprofit Build a Green to determine if there are any services Build a Green can provide that the county weatherization program can't, because there's qualifications for both of us in terms of who we can serve and which part of the county we can serve in. So it's quite possible that there's some things one can do and the other one can't, and vice versa. And both of those programs then will coordinate with two other entities that provide home improvement services. One is in our county, like many places around the country, you have community development block grants, and the county and a number of the cities get those grants and provide home improvement services. And so we'll look to them to see if there are things they can do that can help augment our weatherization work. And then there's also another program called the Community Energy Services Corporation that both Build a Green and the county work with that can also augment those services. For example, if there's work that needs to be done at a home, like let's say they have knob and tubing wiring, which prevents us from providing insulation services, maybe it's possible that either the community development block grants or CESC might be able to do that work, then enabling us to do the weatherization work. So that's how the program's intended to work. We've been going at it for a few months now, and we've gotten six referrals from the nurses so far. We really consider this a pilot effort since it hasn't been done so far, and we're hoping to get at least 20 referrals this year to make it a good pilot program to be able to figure out what works, what doesn't work, how to best coordinate our services, and then, like I said, how to write this up so other counties in the state who all have cap and trade funding and many have weatherization programs can use that to help them design what works best for them. And just to end on a high note, getting back to the gentleman Leonard who I met, through our weatherization program, we were able to get him air conditioning on an emergency basis because he is medically vulnerable. And so last month, there was a heat wave in Antioch where it was over 100 degrees for a number of days in a row. And so instead of ending up in the hospital, Leonard was able to stay in his apartment. And, I think right there, for me, was a tremendous success. So again, thank you very much, and I'd be happy to answer any questions.
Thank you very much, Michael. I love the personal example. I think sometimes it's like you said, we forget that it's the person, the individual. We get lost in the theory and in the plan, and we forget that it's individual. So thank you very much for that. So we've got a few more questions. We've got a little bit of time left, about 5 minutes. So I think this one goes back to Michael McCormick. Michael, how will AB 398 carbon cap and trade extension affect the state's climate goals?
398 is AB 398 is a successful bill that really helps us to extend cap and trade beyond 2020, which was its original sunset. So it's going to continue to ratcheting down emissions towards our longer term goals. So it's going to significantly contribute to our reduction targets.
Great, thank you. Let's see. I think we've answered. Well, this is a question I'm not exactly sure any of you can answer it, but it says, how do Californians interact with the tools and with the government about climate change? That's kind of a real broad, generic question. Any thoughts, anyone?
Tell them all their mics are open. All the panelists' mics are open.
All the panelists' mics are open, so if any of you can take a stab at that.
Well, I can certainly start it from the Office of Planning and Research perspective, and obviously others will have other mechanisms to access and engage. But we have the California Air Resources Board and the Integrated Climate Adaptation Resiliency Program Technical Advisory Council, which are both public meeting bodies that you can attend and participate, provide comments on, and engage directly I think there's a number of different ways to engage on the policy side, and it's sometimes challenging because we do have so many things going on at the state level when we're releasing draft documents or trying to get feedback. There's a certain level of workshop fatigue because we are out doing outreach regularly. And I'll be in San Luis Obispo later this week, actually talking about some climate change related efforts. And so there's a lot of engagement happening. And so I would encourage you to be aware of the opportunities for that engagement locally. The state's doing a pretty good job of reaching out to our local and regional partners right now. So there are things happening within the communities, local communities. You don't have to come to Sacramento for everything. But when there are webinars and workshops, it is really helpful to have the engagement from local and regional partners so that we understand what you guys are facing and the challenges that you're struggling with. So I would just encourage you to sign up for as many email lists and social media accounts and be aware of what's happening that way. And then actually submit those comment letters that we're always asking for on policy documents and guidance documents, because we really do incorporate the feedback that we receive from the public and partners when we're thinking about those final documents and how they're going to be helpful to the public and other folks in the state of California.
Thank you. Any other thoughts? Anyone?
This is Meredith Millett from CDPH. I would just say that all of the tools are publicly accessible, but we generally feel like the local health departments and local community-based organizations are better equipped to be relaying information or providing things that people, the public, can directly interact with. So we sort of focus on providing the data and the tools and technical assistance for them to then translate it into other tools and materials.
Thank you. Matt or Michael Kent, any other thoughts before we bring this to a close?
I would just like to echo what Meredith said. We try to make all of our data publicly available on the city's data portal. And I think one of the goals is to give community-based organizations and advocacy groups the tools to develop their own adaptations and interventions and advocate for that. And we're very open to hearing feedback from that.
Great. Well, thank you all very much. It's been great. Again, our topic next week is climate change and health equity. Linda Helland from the Office of Health Equity will moderate a panel including Jackie Patterson from the NAACP, Dr. Gina Solomon with Cal EPA, and Nick Steinberg, Director of Analytics with 427. So we will talk to you again next week. Have a good week. Thanks a lot.